Okay, class. Today we are going to talk about the postsynaptic modulations. I think in last week I stopped at this particular chapter, this particular slide. Okay, so this process basically, if let's say we call it as a postsynaptic modulation, is because try to imagine if let's say you are attending a concert. Okay, so presynaptic neuron basically is like the performer. They release the neurotransmitter like a dopamine onto the stage. So this postsynaptic neurons is basically is the audience. Okay, unlike a passive crowd whereby this postsynaptic side can adjust the sensitivity. For example, like they're having a remote control for the fine tunes and the volume for the performance as well. So these modulations basically they able to trigger some of the chemical mediator that act on the receptor to alter the ion channel function. If let's say we talk about the ion channel functions, so you have to remember about the calcium and the potassium. Okay, so other than calcium and potassium, basically we do have a second messenger, for example, like the CAMP. So when a calcium channel are upregulated, the neuron becomes more excitable, so they are ready to fire faster. On the other hand, if let's say a calcium channel has been opened, okay, the neuron will start to quiet down. So what amazing over here is that many of the drugs that we are using in the clinical pharmacology, for example, next week we're going to talk about this, antidepressants, medications, the antipsychotics, and even for the mood stabilizer, for example, like people having bipolar disease, we target and at this particular exact mechanism. Okay, not just blocking the receptor or stimulating the receptor, but we try to reprogramming on how the postsynaptic neuron respond towards the signal. Okay, so if let's say you still recall, previously we able to do antagonists or agonists in this particular receptor, but in postsynaptic modulation, basically we change the calcium and potassium functions. Okay, so do remember it's not just about whether a message is sent, okay, but it's how the message is received and interprets and reshapes. So that's what make a postsynaptic modulation is a powerful concept in both of these neuroscience and on the therapeutic of the CNS system. Okay, now we talk about this neuromodulation concept. Previously, if let's say you still remember when we talk about the traditional neurotransmissions, neurotransmission basically is like a message. Okay, they are quick text message whereby they are fast, precise, and over in a milliseconds. Okay, on the other hand, if let's say we talk about the neuromodulations, okay, it's more like a very slow burning email change. They are email, they are not message. Okay, not like a WhatsApp. So these neuromodulations, they are more slow and they are gradually shift on how the system behave over the time. So from a second, it become days. So in this case, we are not just talking about a classic neurotransmitter zipping across the synapses and triggering the ion channel directly. Instead, in neuromodulations, we are dealing with the modulator like dopamines, serotonin, norepinephrines, and neuropeptide as well, whereby they don't act as a main messenger, but rather they adjust the volume of the sensitivity of the entire synaptic system. So what they did is basically they tweak the efficiency of a signal transmission without participating directly. Okay, they often through a very complex intracellular signaling cascade whereby they involve with a second messenger, not through a fast acting ligands gate ion channel. Okay, so like having a backstage manager who doesn't perform on the stage, but they change the lighting, the sounds level, and the timing, so they can affect or impact towards the performance of the concerts. Okay, so postsynaptic modulation or neurotransmodulation is more toward the second way. Okay, so when we talk about the pharmacological agents, we targeting on this pathway, so we can have a changes of the medications or regulation as well. It's slower, but it can have a deeply transformative. Okay, moving forwards, now we're going to talk about the features of the neurotransmissions, whereby we know as a core transmissions. So what is core transmissions? Whereby when a single neuron have been released, not just one, but they have a multiple chemical messenger as well. So typically there is a very fast acting neurotransmitter and a very slow acting modulator like a peptides. Okay, so this core release substance, they interact with their own specific receptor, and then they can exert effects on both of the presynaptic and the postsynaptic side as well. So what interesting is that each of these components, we call it as a chemical cocktail, whereby they behave differently as well. Okay, so in a different manner as well, and for example, like the degradations and the reuptakes. So, for instance, the neuropeptides might ligands longer in a synaptic cleft compared to the monoamines like norepinephrines. So, whereby this can allow them to reach more distant target and produce a long-lasting effect. If let's say you still remember, okay, I think in the class I draw a tables, so you can relate back with this particular table as well. Okay, so when they have more longer synaptic, so they can have more longer times to react. Okay, so whereby these do allow them to have a more distance targets and produce a longer lasting effect as well. So offering a forms of a fine-tuned regulations that basic fast synaptic transmission cannot achieve. So this is a very clever strategies of the nervous system as well, whereby they use both rapid and delay signal to shift the tissue response in a dynamic and more layered method as well. Okay, if let's say you still remember, I mentioned that in our CNS and the PNS system, basically, although we have a very fast acting modulations like neurotransmissions, but we do need something that is more slower and longer effects. Okay, so whereby they come with the neuromodulations and the core transmission as well. Okay, a very good example of this particular actions that we can see over here is the noradrenalines and the ATP core transmissions at the sympathetic nerve ending. So in this model, what we can see, the ATP, they provide a very rapid, a very fast response. Well, noradrenalines, okay, over here they're written as a NA, noradrenalines. So these noradrenalines, basically they produce an intermediate response, okay, and a peptides, for example, over here, neuropeptides, okay, neuropeptide Y and PY over here, they contribute to a slow, a sustained effects. Okay, so you can see we have rapid, intermediate, and slow. So whereby they tie up with the release of the system, allow for a great control over the tissue function as well. Similarly, in the parasympathetic system, whereby our acetylcholine, if let's say still remember ACH, they induce a fast response, whereby our nitric oxides NO, they provide intermediate signals, and our vasoactive intestinal peptide, okay, VIP, they support a slower and more prolonged response. So these kind of like coordinations can ensure the target tissue receive both intermediate signals and modulatory cue, whereby they enables our physiological regulation as well. Almost like a symphony whereby each of these instruments, they will come at the right moment to shape the particular performance as well of our body conditions. Okay, now we talk about what happened after the neurotransmitter have done its job. Okay, because the world of the synaptic signaling precision is everything. Once a neurotransmitter like acetylcholines or serotonin have been released into the synaptic cleft and bind to the receptor, the signal must shift terminate to avoid the overstimulations. If let's say you still recall, as I mentioned, if let's say once the synaptic cleft or the particular receptor have binds with our acetylcholines, so they have to remove it, right? Because we want to avoid overstimulations or misfiring or signal confusions that whereby the disease can happen. Okay, so if let's say you're wondering why they have to shiftly terminate, it's because the action, if let's say they remain brief and localized, so the nerve system can maintain a high frequency and high fidelity communication. So there is a two-way these things can happen. Okay, first we use the enzymatic degradations or we do a reuptakes.